All right, Aaron, thank you. We are joined now by Dr. Ashish Jha, the director of the Harvard Global Health Institute. Doctor, good morning to you. You just heard the report. You've obviously seen the numbers. How concerning is this spike in cases, and what do you attribute it to?
Yeah, good morning. Thanks for having me on. So the numbers are concerning, particularly in states like Arizona, North and South Carolina, Florida, Texas, places where we're seeing pretty consistent increases. It is about 2 weeks after Memorial Day that we're seeing this, and this is what we were worried about. I had hoped that the fact that people are spending more time outside, that it's summer, we would not see such a big increase so fast. But it's more concerning than I had hoped we would get at this point.
And then that just raises the question. Obviously, we've seen, thousands of people out on the streets night after night, some trying to practice social distancing and wearing masks, but yet we've seen the images, many of them packed together. Do you worry about a further surge because of that?
I do. I think protests are also going to fuel more cases. The key is here that people do need to be wearing masks. And I've seen some protests where most people are wearing masks, others where people are not. It's really, really critical that people wear masks because we think that as the data is coming in, that can really help a lot.
Let's talk about the surge of cases, because many people say, well, aren't we testing more? Doesn't that explain the numbers? And I wonder if you could put that in perspective. And what are the numbers that you look at to determine, okay, what is suggesting an outbreak and what is just a function of, hey, we're testing more, you're going to get more cases?
Yeah, so testing does help identify cases, of course. And so we have been so behind in our testing approach for months that we were missing most of the cases out there. So that as testing's gotten better, we've identified more cases. That helps. But testing is not going to explain the increases in hospitalizations, right? That is coming from just more people getting sick and needing hospital care. So I think testing is a part of the story, but certainly doesn't explain the whole thing. I look at all of it. I look at testing, I look at cases, hospitalizations, and death, and really try to look at case numbers and ask how much of that can be explained by testing. Some of what we're seeing can be, but not all of it by any means.
You have a very dire prediction about the number of deaths we're going to see in this country by the end of summer, by September, 200,000. And I believe that's a rather conservative scenario. Can you explain how you arrived at that number and what can be done about it?
Yeah, so this is obviously very concerning. We right now have between 800 and 1,000 Americans dying every day from coronavirus. And when you put all the models out there together and you look at really the consensus, if we just stay flat, if we don't have any more spikes all summer and just stay flat, we'll continue to have 800 to 1,000 people dying every day. That's about 25 to 30,000 a month. And over the next 3 months, we will cross the 200,000 mark. We're at about 113,000 now. So sometime in September, we're going to cross 200,000. And we still won't be done. Right? This pandemic is going to be with us till next spring or summer when we have a vaccine. So this is not faded, by the way. We don't have to live with hundreds of thousands of Americans dying. We do have to get people to wear masks. We do have to do as much social distancing as possible. And while we've gotten better on testing, we're nowhere near where we need to be. And we really need the federal government to step up and decide that it doesn't want to have hundreds of thousands of Americans dying and help states ramp up testing and tracing. That's the other piece of this that's still missing.
So you're not suggesting another nationwide lockdown like we had that was obviously so devastating to the economy, but you think there's something short of that that would make an impact so that we don't have 200,000 deaths by September?
Yeah, the key here is the longer we wait, the harder it is to avoid the lockdown. We basically ignored the virus for all of February and a good chunk of March, and then we had to shut down. And my point is, let's not do that again. Let's do everything in our power to get the virus under control so we don't have to go to another lockdown in order to avoid all these deaths. I think we can. We absolutely can. I don't want a lockdown. Nobody does. But if we just act like the virus isn't there or somehow it has magically gone away, we're going to be confronting a much uglier reality. And I don't want to do that. I want to be proactive on this, Paris.
Dr. Jha, it's good to get your perspective this morning. Thank you very much for joining us. We appreciate it.